Hi everyone, I'm going to go through chapter 7, 8, and 9. Let's go ahead and start with number 1. So this one here is pretty cut and dry. We did do the insertion of the endotracheal tube into the trachea. So one thing here, the respiratory failure was responsible for admission and is designated as your principal diagnosis. That patient was intubated in the ER, maintained on mechanical ventilation till 5 days, which is more than 96 hours. Okay, number 2, once again, we want that respiratory failure first, and any other acute condition, principal diagnosis will depend on the circumstance. Number 3, we have Streptococcus pneumoniae is the organism, so that's why J13, it needs to be very descriptive here. We have COPD, okay, and we do have hypoxemia, which is assigned as an additional diagnosis for the hypoxia because it is not inherent to the pneumonia, which is saying it's not integral to the pneumonia, so we can code it. All right, then we have our abscess code for number 4. Let's go ahead and go down here. We have E10 for the diabetes, then we go into our ulcer. We have COPD again and bronchitis and long-term use of insulin. Okay, number 6, bronchospasm is principal diagnosis, COPD. We do have alcohol dependence with withdrawal, non-effective gastroenteritis, personal history of colon polyps, and then our procedure code. Okay, all right, so number 7 here, rule out apnea as a probable diagnosis. This is inpatient, and conditions are coded as confirmed. Okay, so at this point, we go ahead and we can code the rule out. This was outpatient, we could not. Number 8, we have pneumonia due to inhalation of food and vomit. What else do we have? We have the drainage. COPD for number 9 with asthma. Make sure anybody, if you have any questions on these, send me a text or a email, I should say, not a text. Number 10, we have asthma. And with the status asthmaticus, personal history of neoplasm of breast. Number 11 is heart failure. We have pneumonia again, COPD. 12 is acute respiratory failure. We have chronic obstructive pulmonary disease. Let's go to 13, pneumonia. We are coding the dehydration. Number 14, we have asthma. With 14, one thing you want to remember that your Q code is going to be congenital because they were born with it. 15, we have lymphoma. We have pleural effusion, and then our 2 procedure codes. So then we get into chapter 8, digestive. We have vomiting, and we do have dehydration. Complications of bariatric procedure is not assigned because the vomiting is not a complication of the surgery. Okay, number 2, we have pneumonitis, dysphagia, and then we also need the dysphagia R code because right here, dysphagia is a late effect of the previous cerebrovascular accident. I69.3 is a subcategory. Okay, so make sure it does say use additional code. One thing to remember, you can stop this video at any time, write them down. Okay, here we have for number 3, gastric ulcer with hemorrhage. Number 4, we have pancreatitis, unspecified. And we have other, then we have specified diseases of the pancreas. And then we just go into our procedure codes. Okay, so 5 and 6, I'll have you just look at. There isn't any real big coding here. The only other thing would be the acute blood loss anemia for number 6. Hepatitis B for 7. Okay, so everybody, once again, make sure you look at these, review them. Okay, number 9, we have 2 episodes. We have colitis, and then we have the resection, and then we have the bypass. Episode 2, come back in for colitis again, and the bypass. And then we have episode 3, encounter for attention to the ileostomy, and then we have to repair the ileum. Okay, number 10, disease of the anus and rectum, excision of the rectum, open approach. Pancreatitis, unspecified for 11. Hopefully you're finding that these are a little bit easier. This test in general does go much better for students than in the past. But again, just make sure you rule or read through your rules. One thing is, even with pneumonia, I always tell students back to the respiratory, know the difference between lobar and lobe. Okay, so with these, there isn't anything major. 15, 16. So let's go ahead. I'm going to add these on too. So, okay, and then we have gentourinary. With this, we have the sepsis due to E. coli. You also got to post or code the UTI, and then you have to code the E. coli separate. So some students here put the A code in, so make sure you review that. Okay, so with that, number 3, we have hypertensive heart and chronic kidney disease without heart failure. We have I-13. Okay, so we have hypertensive kidney disease. We have 5. Number 6, you will see here I-12s for both of these. And then we look at that word hypertensive. So 7, hydronephrosis. Okay, so again, go through these. Let me know if you have any comments, concerns. Kidney donor here. Endometriosis of the uterus, of the ovary, and of the fallopian tube. We need all 3. Sorry about that. All right, so hopefully you review these answers. I will attach them also. And let me know if you have any concerns.